Welcome back to the program. Now, let me show you something in the president's 2020 New Year letter to Nigerians. Now, this was way before Nigeria recorded its first case in February. And even in China, there were still controversies on the nature of the unknown virus at that time. So here's what the president said then in that letter. He says, I have met international partners such as Gavi, the Vaccine Alliance, and the Bill and Melinda Gates Foundation. Well, that's not what you have on the screen. This is his 2021 New Year message. But I'm talking about the 2020 New Year message. And don't forget, he spoke about Gavi, the Bill and Melinda Gates Foundation, who support our social welfare programs. By the way, it is through the Gavi arrangements that over 40 million Nigerians are expected to be vaccinated. And the alliance has also helped in getting millions of Nigerians immunized against other diseases, while the Bill and Melinda Gates Foundation has committed over $1.7 billion into development of vaccines, which we're seeing now. You will think the president knew this partnership will be needed in the days to come. Well, Nigeria has since come a long way after that in the fight against Covid-19. And tonight, we speak with Dr. Sani Aliyu, the National Coordinator, Presidential Task Force on Covid-19. He joins us from our Abuja studio. Good evening and thank you for joining us, Dr. Aliyu. Now, I mean, like I said, we have come a long way. We're in our second wave. It's not something to cheer about, but clearly this is a very present challenge with us. We've seen cases over 1,000 in the past days. So please tell us, what is the projection for 2021 regarding COVID-19?
Well, what I can say certainly, as you said, is that we are in the second wave. In terms of a projection, it really depends on how we continue to behave as a community, as a country, in terms of complying with our protocols. What we are seeing now is a huge increase in the number of cases. I'm sure most people who have been following the numbers would realize that the numbers we have now far exceeds what we had back in June, July this year. In week 52, which was the week that we've just finished, we've seen a tripling in the weekly number of cases compared to week 49 to 3 weeks ago. At the moment, we are running at close to 6,000 new cases per week, which is really huge. Our hospitals are already starting to get overloaded, and we are already starting to feel the pressure within the health system. So when you talk about the projection really depends on whether people will start taking this very seriously and start following those non-pharmaceutical interventions that we've been talking about for the last 1 year. We've been able to demonstrate that it is possible to flatten the curve, but we need the cooperation of everybody. We need the cooperation of the general public. We need the cooperation of the state governments. And in this way, I'm actually very pleased that some of the state governments have taken decisive action to enforce some of the rules. It should be socially unacceptable nowadays for people to go out without a face mask. We should be assuming that whoever we meet outside our immediate household could potentially be infected with COVID-19 and take those precautions that are necessary. 2021 should be a better year than 2020. But it can only be a better year if we continue to comply with those protocols while government tries to get the vaccine across to our citizens to make sure that we are protected.
Well, like you said, the role of governors will be vital in achieving this. And the governor of Kogi State believes that we don't need, in his words, the brouhaha about COVID-19 and vaccines now. In fact, he thinks that we don't need to participate in the marketing of vaccine or COVID-19. That was his message, not to Nigerians, but to the PTF in particular. So hearing this and hearing the response that Nigerians have given, how do you respond to that?
Well, I'm not going to join words with my good friend, the governor of Kogi, or be specific in terms of any particular state government. We're talking holistically here. All I can say is 33 people died of COVID in the last 1 week. Are we saying that those people died for nothing? COVID exists. Anybody who says COVID-19 does not exist is probably living in a completely different world. We've been having, in the last 1 week, as I said, we've had a tripling of cases. You can see what's happening in the US, you can see what's happening in the UK, etc. And when it comes to vaccines, this is not the first time we're using vaccines. We've had childhood vaccines being introduced for years. And there's always been that debate in terms of safety and efficacy, the balance between harm and good. And the countries, the international community, they are not stupid enough to introduce something that will harm their people. These vaccines have been tried, They have been trialed. They have gone through phase 1, phase 2, and phase 3 trials. If the vaccine was available today in this country, I will have it, and my family will have it. And I'm very sure the vast majority of Nigerians will accept a vaccine, because the vaccine, together with the non-pharmaceutical interventions, is the only way we can get on top of this epidemic. And by the way, Nigeria cannot afford to be a pariah nation. I can tell you, Kayode, that in the coming months, as more and more people in the world, as millions start taking up this vaccine, it will be very clear whether or not there's going to be an issue with safety. And I am very certain that these vaccines will continue to be safe and effective based on the robustness of the clinical trials that have been undertaken. And if you don't have the vaccine, you're going to be stuck, because I am very certain that countries internationally in the next 6 months to a year will start insisting on a certificate before you get into their country. So you'll not be able to go for Hajj or Umrah or the Christian pilgrimage to Israel or on your holiday to Dubai or for business to China and South Africa if you do not have the vaccine. Government will not press you down and inject you with the vaccine. No, it's going to be voluntary, but it will be free, and it will be initially for a specific group of people. So, for instance, we're going to prioritize healthcare workers, we're going to prioritize the elderly, those above the age of 60, and those with comorbidities such as diabetes, cardiovascular disease, etc., because these are the people that are most likely to have severe COVID infection.
Well, Dr. Aliyu, it's
we
only...
look forward to having the vaccine in the coming 4 weeks, hopefully arriving, the first batch arriving by the end of January, and we will vaccinate. And those people who don't want to vaccinate, of course, we will try as much as we can to convince them. We will make use of risk communication strategies, because we've had previous experience, remember, with polio. There wasn't, a lot of things were said about the polio vaccine, but at the end of the day, what happened? We finally were able to get on top of things, and we were able to convince people, and I hope we'll be able to convince our communities, our religious leaders, traditional rulers, to come and line up behind us and make sure that everybody who needs to have the vaccine gets the vaccine.
So will there be
access? It will be free.
Right.
And it will be important that we use it in order to get on top of this epidemic. The rest of the world is doing so, and we need to do the same as well.
Just to be clear, Dr. Aliyu, I mean, you talked about some people getting stuck if they don't get the vaccine because they won't be able to travel abroad. But, you know, that's for a privileged few, if I can use that expression. So for the ones that don't have plans to travel, really, I mean, they're here in Nigeria and they plan to stay in Nigeria for the foreseeable future, will there be any consequence for them not taking the vaccine? Will there be any of such?
Well, in public health terms, what you try to do when it comes to public health interventions is you don't make it compulsory unless you really have to. But you try as much as you can to create public awareness, to make it very clear to the public that it's actually in their best interest to do so, and also to demonstrate how safe it is. By the time the vaccine comes to Nigeria, already more than 1 million have had the vaccine in Israel. By the time it comes to Nigeria, end of January or early February, hopefully, we would have had tens of millions of people across the world who would have had this vaccine. And it will be very clear that it's safe. It will be also very clear that it's effective. And as you said, okay, a small number of Nigerians travel out of the country, but it's the ripple effect of those Nigerians traveling out, because that's where the economy is driven. In the same way that you would have issues with people traveling out of the country, so also those people that bring business to us into the country, nobody would want to be traveling to a country endemic for COVID-19. No. So whatever happens, even our neighbors, for instance, if they get on top of the epidemic, and meanwhile we have a raging epidemic ongoing in Nigeria simply because we are not keen to take the COVID vaccine, and we become a pariah nation, we will be a risk to the entire sub-region in terms of the control of COVID. So,
okay, Dr. Aliyu, because of our time, I need to put in some questions.
It will not be compulsory.
Right. Pardon me, because of our time.
It will not be compulsory to have the vaccine.
Okay. That's noted. So quickly, let me just get your responses to this. Which of the vaccines are we getting? Because there's Pfizer, BioNTech, there's Moderna, Oxford, AstraZeneca, there's Sputnik 5, there's China's Sinopharm, and the rest. So which of the vaccines are we getting in Nigeria?
So we're not going to put all our eggs in one basket. That discussion is still ongoing. But as you said at the beginning of the program, we are working very closely with Gavi the vaccine we would use will be vaccines that have been validated, they have undergone the full clinical trials required, and we know that are safe. And there will be vaccines that are acceptable also to the international community, including Gavi. So that's what I can say at this point in time. I don't think people should worry too much about the logistics side of it. The Primary Healthcare Development Agency is already working very closely to make sure those vaccines that require ultra-cold chain arrangements, that arrangement is put in place. And from the PTF side, we've already asked the Primary Healthcare Agency and the Federal Ministry of Health to make sure that they do some sort of early exercise to make sure that everything is in place. But even with the cold chain, for instance, they have to be thawed. You cannot inject a frozen vaccine at -70 into a human. So there will be some allowance in terms of the number of days that you can keep the vaccine at a normal refrigeration temperature before you administer. But people don't need to worry too much about those logistics. I'm sure it will be done, and it will be done properly.
Well, something a lot of people are worried about, Dr. Aliyu.
We will provide all the information required.
Right. Something a lot of people are worried about as we wind down on this is the talk about lockdown. So in 2021, if you can project, is there a possibility of a lockdown, or what will make us go into a lockdown if that's a possibility? Briefly, please.
I would turn the question around. Do you want a lockdown? And I think the vast majority would say no. Well, if you don't want a lockdown, the only way we can avoid a lockdown is to make sure that we use our face mask, we avoid mass gatherings, we avoid mixing with people that have respiratory tract infections, we sanitize our hands, we follow those non-pharmaceutical interventions. The very vaccine that we currently have at the moment are those non-pharmaceutical interventions. If the numbers continue to go up, all options are on the table. But we need to make sure there are countries in the world that have been able to control this pandemic simply by following these non-pharmaceutical interventions. They may be inconvenient, but they will not be as difficult as a lockdown. We don't want to have a lockdown because of the impact it will have on our economy. But no government will sit down and allow their citizens to become infected with a preventable disease and die from it.
Dr. Aliyu, clearly 2021
of the second wave on our health system. At the moment, people
clearly
are starting
2021,
to die, and we really need to take this seriously.
Right. Clearly, the year will be a challenging one, but we wish you the very best. And we'd like to thank you so much, Dr. Sani Aliyu, the National Coordinator of PTF on COVID-19, for shedding some light on some of these issues. Thank you very much.
Thank you for having me.